Good morning to all those who make this broadcast possible. To Abdiel, to our sign language interpreter, and good morning to everyone tuned in to this briefing. Today, 7,150 people are hospitalized in Cuba. 5,301 are under observation. There are 1,269 suspected cases and 580 confirmed active cases. Yesterday, we processed over 7,000 samples, 7,550, in our various molecular biology laboratories. 2,814 of the samples were processed at the Pedro Curi Tropical Medicine Institute, 904 in Havana's Hygiene, Epidemiology and Microbiology Center, 843 in Villa Clares, 276 in Santiago de Cubas, 416 in the Hermanos Almajeras Hospital Laboratory, 348 in the Manuel Fajardo Hospital, 339 in the Civil Defense Laboratories, 321 in the Naval Hospital, 301 in the Molecular Immunology Center, 298 in the ICA Laboratories, 291 in the Fructuoso Rodriguez Hospital, 211 in the National Center for Genetics, and 188 in the Genetic Engineering and Biotechnology Center Lab. Of the 7,550 samples processed, 66 tested positive for COVID-19. That's 66 people with the virus. This brings the total number of samples processed in the entire country since the pandemic began to 613,994, of which 5,597, or 0.91% of people, have tested positive for the virus. As I always mention, samples from all of the country's territories were tested, the most from Havana with 2,884, Mayabeque 261, Matanzas 913, Cienfuegos 111, Villa Clara 148, Sancti Spiritus 726, Ciego de Avila 1,512, Camagüey 307, Holguín 415, and so on and so forth from all of the country's territories. Of the 66 positive cases diagnosed yesterday, 65 are Cubans and 1 is a foreigner, in this case a Frenchman and temporary resident in the country living in Havana, who contracted the virus here in Cuba and is therefore not an imported case. However, 65 of the 66 positive cases yesterday are autochthonous and 1 is imported. This case corresponds to a Cuban who recently returned to the country and was sent directly to an isolation center where they were tested for the virus, which came back positive for COVID-19. The individual is originally from Granma province and the municipality of Haguaní. However, being an imported case, it does not count toward either the province's or municipalities' overall confirmed case rate. Of the 66 positive cases yesterday, 61 are confirmed case contacts. This means that 5,089 people, or 91% of all cases on the island since the pandemic began, have had contact with someone who previously tested positive for the virus. The source of infection linked to 4 cases yesterday is yet to be determined. The source of infection in 66 cases reported over the last 15 days is therefore still being investigated. Yesterday, one person to have tested positive for the virus contracted it abroad, meaning that imported cases rise to 442. Of the 66 diagnosed cases yesterday, 54 are male, representing 51% of all cases, and 12 are female, for 49% of all diagnosed cases on the island. 51, or 77.3%, of the 66 cases yesterday were asymptomatic at the time of testing. Overall, 60.6% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing. And this figure rises to 70.1% of cases diagnosed over the last 15 days. By age group, 4 positive cases diagnosed yesterday are under the age of 20, 3 of which are under 18 years of age, for a total of 612 children or pediatric cases to have tested positive for the virus in Cuba. Of these, 526, or 85.9%, have recovered from the virus and been discharged from hospital. I reiterate, no one under the age of 20 has died in Cuba as a result of COVID-19. Meanwhile, 22 people to have tested positive for the virus yesterday are between 20 and 39 years of age. 36 cases are between 40 and 59, and 4 are over the age of 60. Of the 66 cases diagnosed yesterday, 40 belong to Ciego de Ávila, 14 to Sancti Spiritus, 10 to Havana, 1 to Matanzas, and 1 imported case to Granma. The 10 cases from Havana belong to the municipalities of Centro Habana with 2, 10 de Octubre, 1, Regla, 1, Habana Vieja, 1, Cerro, 1, San Miguel, 1, Habana del Este, 1, La Lisa, 1, and 1 case to Plaza de la Revolución. The case diagnosed in Matanzas belongs to the municipality of Cárdenas. The 14 cases from Sancti Spiritus belong to the municipalities of Sancti Spiritus with 7, Trinidad with 3, Yaguajay 3, and Taguasco with 1 case. The 40 cases from Ciego de Ávila belong to the municipalities of Ciego de Ávila with 37, Venezuela with 2, and 1 case to Baragua. And the 1 imported case belongs to Granma and the municipality of Higuaní. Given yesterday's results by province, Ciego de Ávila continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, with 55.83. Havana follows with 18.50, then Matanzas with 10.14, Sancti Spiritus 9.44, Mayabeque 2.86, Artemisa 2.72, Camagüey 0.39, and Holguín with 0.20. Cuba's rate therefore stands at 7.02 per 100,000 inhabitants over the last 15 days. Meanwhile, Cienfuegos, Pinar del Río, Las Tunas, Villa Clara, Granma, Santiago de Cuba, Guantánamo, and the Isle of Youth Special Municipality have reported no new cases over the last 15 days. Some of these provinces have reported no new cases for several weeks, and others none over the last few months. To summarize, of the 5,597 people who have been diagnosed with the virus thus far in Cuba, 580, or 10.3%, are active hospitalized cases. Of these, 572, or 99.1%, are clinically stable. Yesterday, no one died as a result of the virus, meaning that the COVID death toll on the island remains at 122, with a mortality rate of 2.16%, lower than the global rate of 2.99% and the regional rate of 3.34%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 27 people were discharged from hospital, a negative result when compared with the number of confirmed cases diagnosed yesterday. 4 people were discharged from hospital in Havana, 7 in Matanzas, 1 in Sancti Spiritus, and 15 in Ciego de Ávila. This means that, to date, 4,893 people, or 87.4% of all confirmed cases in Cuba, have recovered from the virus. Today, 2 patients continue to be in a critical state in hospitals in Matanzas and Camagüey. Meanwhile, 6 patients are reported as serious and being treated in hospitals in Havana and Camagüey. Yesterday, 3 patients joined the group of those reported as serious, and 1 serious patient passed to closely monitored. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 245,472 people were diagnosed with the virus, for a total of 33,423,517 confirmed cases since the start of the pandemic. Yesterday, 3,894 people died of the virus worldwide, for a total of 1,002,678 COVID-19 fatalities, and a mortality rate of 2.99%. The region of the Americas, which accounts for 49.56% of all cases worldwide, reported 88,036 new cases yesterday, for a total of 16,566,344 people to have been diagnosed with the virus. Meanwhile, 1,596 people died of COVID-19 in the region yesterday, for a death toll in the Americas of 553,817, and a mortality rate of 3.34%. The United States continues to top the list of countries worst affected by the pandemic, followed by India, Brazil, and Russia. These are the countries with the highest number of cases worldwide. From the Americas, after the United States, which has over 7 million cases, and Brazil with more than 4.5 million, comes Colombia with almost 820,000 cases, Peru with more than 806,000, then Mexico, Argentina, Chile, Canada, Ecuador, Bolivia, the Dominican Republic, Panama, Guatemala, and Honduras. These are the countries with the highest number of cases in the region. Meanwhile, Cuba occupies 21st place on this list. This is the information we have on the behavior of the pandemic in Cuba and the world.